Good morning, everybody, and welcome to this month's vlogcast. I am absolutely delighted to have on screen Dr. Nauman Butt from the Clatterbridge Cancer Centre in Liverpool. You're an amazing advocate for MPN patients and MPNs generally, and you sit on our medical committee, so we always value your advice. And today we've decided to talk about side effects from some of the medications prescribed for MPNs. Dr. Butt, would you like to tell us a bit about the side effects?
Okay, so well, I'm very grateful for that introduction. You're very kind, and I'm very flattered to be asked to talk on this vlogcast. So I thought we could talk about today is particularly about some of the skin complications that MPN patients experience with regards to their condition as well as their treatments. And so the two main skin problems that MPN patients experience, one is itch or pruritus, and that is a whole talk in itself. But I think what I'd quite like to explore a little bit is about the potential risk of skin cancers in patients with MPN. So it is well recognised that MPN patients have an increased risk of skin cancers. This is particularly the disease itself increases their risk of skin cancers, but some of the treatments that patients are prescribed also increase their risk of skin cancer. So I think it's important to be aware, well, what are the patient groups in whom are at particular risk of skin cancer. And if you go to the NHS website with information on skin cancers, it will outline patients with potential risk factors, and those are patients particularly with fairer skin. Some folk believe that those, if you have an increase in moles or freckles, you're potentially at a slightly higher risk of skin cancers. If you have a previous history of a skin cancer or a family history of skin cancer, then you may be at increased risk. The condition itself increases the risk of skin cancer, and the medications we've already will explore those in a second. But also it's to do with sun exposure. And the risk of skin cancers particularly are in the sun exposed area. So those are your scalp, around your ears, the back of your neck, your hands and your feet. And the amount of skin exposure is proportional usually with age. So the older you are, the more risk you have of developing skin cancers. So that, by way of introduction, is the main concern we have with regards to skin, and particularly those patients who are at greatest risk.
Gosh, that's really interesting, because when you get all the, well, certainly with some of the medication like hydroxycarbamide, there's not too much about all the skin problems that can arise. You know, I think for MPN patients, it's really important we know a bit more about that, because we know an awful lot about itch, don't we? But we do know, as you said earlier, not a lot about skin problems. And do they vary? As you say, it's age dependent, but what are the medications specifically you think that are highlighted in this?
Okay, so the skin cancers that we're concerned about, the classical skin cancers that we associate with sun, are melanomas, but actually MPN patients are more at risk of what we call non-melanoma skin cancers. And there are two main non-melanoma skin cancers. One is called a squamous cell carcinoma, and one is called a basal cell carcinoma. The risk is increased with some of the treatments that we use, and I think many of the therapies we give are associated with an increased risk of skin cancer. But I think for the purposes of this talk, the two main ones I'd like to highlight are probably the commonest ones that patients will be on. One is hydroxycarbamide, and the other agent is called Ruxolitinib. And there are different indications for the use of these drugs, so we won't go into that, but many patients will be on either hydroxycarbamide or ruxolitinib. Depending on what studies you look at, the increased risk of skin cancer for each of these agents is different. It is thought, depending on what study you look at, hydroxycarbamide increases your risk maybe 2.5 times the background for patients who don't who aren't receiving hydroxycarbamide. So risk is 2.5 times. And for ruxolitinib, it's very variable, but it's probably more than hydroxycarbamide. It's probably something in the region of 4 times the background risk. So there is a definite increased risk with each of these agents, and maybe ruxolitinib maybe more so than hydroxycarbamide. There is a view that risk is exposure dependent, and by that I mean the longer you're on the drug, the more chance you have of skin cancers, and there is an association between the dose. So potentially the higher dose medication you're on, potentially that increases your risk of skin cancer. So it's an exposure dependent on dose and length of treatment. So if you're on these medications, then I think it's really important then that you are aware of how to protect yourself against skin cancers as best you can, and what to be vigilant for. I can outline some of that if you'd like.
That would be absolutely great. And I think if you're noticing changes in your skin as a patient, do you take it to your GP or do you take it to the haematology team?
Okay, so again, a very pertinent question. So I think it's important that all patients are aware of the increased risk of skin cancers, and therefore perform a degree of what I call self-surveillance. So they know their bodies, they know their skin, they know their moles, and so they should be vigilant for any new lumps, any new skin bumps, any ulcers, any change in texture to an area of skin, or any discoloration, bleeding, etc. So they can perform that self-surveillance. If they have any doubts at all, then actually my experience is that GPs are very, very good at recognizing skin problems. If they are concerned, they should either your haematologist or your GP should, so you need to take that to a healthcare professional. So either your GP or your haematologist to show them. If there is any suspicion, then skin cancers should then be referred to a skin specialist, a dermatologist, who will then review the skin and will perform the necessary biopsies to confirm and treat if that is what is found. If we have patients who are particularly at high risk, so we've outlined some of the risk factors. So if you've had a previous history of skin cancers, multiple previous skin cancers, then some specialist dermatology services, and we do have this in Liverpool, where they have skin cancer surveillance clinics. So patients who have, say, transplants or are on any medication that increases the risk of skin cancer, particularly our dermatologists will plug them into their own skin surveillance clinics. So they will actually regularly call the patient in and review their skin and look for any suspicious lesions. So yes, look out for any abnormalities of the skin that are unusual for you. Take them to a healthcare professional, and if the healthcare professional has concerns, he will refer them on to a dermatologist. But like you say, there are also things you can do to protect yourself.
And those are, what are your top tips?
Right. Okay. So I think the most important thing, the biggest risk of skin cancers come from skin damage. So the way to minimize skin damage is to minimize your exposure to sun, and particularly it's sunburn. So I think I'm less concerned about as a protected healthy tan. It's the burning that is a particular concern, so you must never burn, but you should limit your sun exposure as best possible. So the simplest ways of doing that are, if we've talked about the sun exposed areas, so scalp, ears, neck, the most important thing is to consider appropriate clothing. So a hat, for example, is a very, very simple measure to reduce sun exposure to those areas. And secondly is to use a high factor sunscreen. So high factor sunscreen protects you against sunburn. The highest you can that you can get applied regularly, liberally. Be aware that it washes off in by the pool, in the sea. So apply regularly, and so long as you don't burn and you have appropriate cover and clothing to the sun exposed areas, you are protecting yourselves optimally.
That sounds amazing. What do you think we at MPN Voice can do to get the advice to our patients?
Yeah, so I think this is something that I think all MPN patients should be aware. I think, as you've highlighted, some of the information that we give seems to gloss over the risk of skin cancer, where there are only 1 or 2 lines, and it is maybe not in the forefront of patients' minds and indeed clinicians' minds. So I think the information leaflets could potentially be more prescriptive in terms of the risk and in terms of some of the protective things that can be done to minimize the risk of skin cancers. I think it's possible that MPN Voice could even consider a dedicated leaflet on MPN and skin cancer, with some of these highlighted, some of these red flag signs and symptoms for patients, and also some guidance on protection.
And how, can I ask you one last question? How are these skin cancers treated? If you have them, how are they treated?
Okay, so the majority of the skin cancers are, if caught early, are very localized, and so most of them, after an initial biopsy, so taking a small sample of that skin lesion, confirming that it's a skin cancer, most of them can be removed or excised, and they are excised with what's called a margin. So they not only take away the lesion, but they take away a small amount of healthy skin round about, so they can make sure they've got good clearance that the skin cancer has been fully removed. Then in some circumstances, depending on how extensive or aggressive the skin cancer is, sometimes in these cancers can be given additional radiotherapy to the skin margins, just so that if there was any risk of a residual bit of skin cancer, that maybe radiotherapy would help treat that. But I have to say, the majority of my patients, the skin cancer is caught fairly early, and excision is all that's required.
Thank you so much. I find this has been really interesting, and I know will be very helpful to a lot of our patients. And I'd like to say a very special thank you to you for not only giving your time for this, but also the wonderful forums in Chester, Liverpool, and Llandudno. And we're very much looking forward to going to Llandudno on the 22nd, I think it is, of September. So hopefully there will be lots of people who will come and hear you talk there. Thank you very much, and look forward to seeing you soon.
Thank you.